I make it really clear that the ICL is reversible, and you can actually keep the ICL in your eye until you get a cataract one day. So people ask me that a lot. So say a 30-year-old comes in, they get ICLs with me. This stays in then until they're 65 or whenever they develop a cataract, just made up a random age. And all the measurements we do for cataract surgery aren't implicated or aren't affected by that ICL being in the eye. So that's really handy to know because you don't have to go back, remove it, then do the measurements, then have cataract surgery. This is just taken out the same day that the cataract's done. We've already done our lens calculations because this doesn't impact on them. And so that's really neat. Clear lens extraction or RLE is not reversible because we're removing the natural lens like we discussed. So some people like that because it's a very definitive treatment and it's usually a one-stop shop, like it's done and then you don't need to go and have cataract surgery later on because we can't do it. There's no cataract to be taken out because we've removed the lens. But it's usually reserved for those slightly older patients because we are, they're both intraocular surgery, but with the lens extraction, there is a slightly higher risk of a retinal tear or retinal detachment in the absence of a posterior vitreous detachment. So if the vitreous hasn't detached, there's a slightly increased risk of that. Again, that is affected by what kind of prescription you have. So if you're extremely short-sighted, that risk is higher in general compared to if you're a long-sighted patient. But we go through that risk stratification at the appointment as well, and we have a chat about that. So, yeah, you can see that there's pros and cons to both, and they're kind of for different stages of life. But there is crossover, and there are technologies like the EVO, like the ICL Viva, that there's going to be crossover. And then Presbyon also falls in the middle of those two. Presbyon with the laser treatment, Presbyon that we've spoken about before, you're not removing the lens. That's a surface procedure on the cornea. So you're still keeping that natural lens, which is nice as well.